Hey guys, what's going on? I just wanted to come on here and talk a little bit. This is my makeup from yesterday, so please don't mind it. I worked 12 yesterday. Worked 2 12s the next 2 days, so we're working with what we got right now. So I just want to talk about what it's like being the lead nursing assistant for your unit. So I kind of didn't ask to become the lead nursing assistant, healthcare tech, PCNA, whatever you want to call it, for my unit. It kind of just happened. Now I've been CNA for 8 years, maybe going on 9. 2011 I became a CNA at the end of the year. Got my New York certification, came to North Carolina, got my North Carolina certification, because when you move, not all the states recognize the other state certifications, so I got another one. And I've been working in a hospital setting for the past 7-8 years. And I've always worked in cardiac, except when I first started CNA. I worked in a nursing home only for 6 months. But yeah, as a lead CNA or lead healthcare tech, whatever you want to call it, I don't have like a title on my badge, right? It's not like I walk around, people are like, oh, she's a lead. She's a lead CNA. She must be special. You know, we don't do that here. I do the same thing everyone else does. I just have more responsibility, pretty much. So as a lead CNA, lead nursing assistant, I am the main preceptor for my unit, which means that I am the one that trains all our new healthcare techs, CNAs, whatever you want to call them, to our unit. So they could be brand new in nursing school, just became a CNA, and we hire them as PRN, part-time, full-time for the summer, whatever. I train them. Also, they could be nursing assistants that have been experienced for 15 years. They still need to be trained to our unit. So like I said, I'm the main preceptor, so only reason why they aren't with me is when they like only work weekends or only work nights. Then of course I work day shift, and I only work one weekend a month, so then they wouldn't be with me. Maybe only once, you know, so it just depends. But we try to get them during the day and try to follow like along with my schedule, because it's helpful. So precepting is, I think, 70 hours a week, 70 hours, not a week, sorry, 70 hours within 2 weeks. So it's 2 full weeks of 12-hour shifts. So I work 3 12s a week, so it's 6 12-hour shifts equals you're done with precepting. That's all the training we give you, and that's all the training you need, to be honest with you. When you're a brand new CNA, brand new healthcare tech, whatever you want to call it, the real life is totally different, and I feel like they don't prepare you for that, you know. You are crunched on time. Of course, like, you know how to do a patient's bath, and you know how to feed someone, and you can get someone up from a chair to a bed. I mean, you could do that, right? But they don't train you for time management. They don't train you for code blues, rapid responses, patients falling on the floor, patients being angry at you, not happy with you, complaining, patients dying, patients bleeding. You know, they don't train you for these things in school. They don't train you for that. So I always tell them, like, when I'm doing precepting, I'm like, listen, you already know what you're doing. You already know the skills because you went to school for them, right? That's not what I'm concerned about. Otherwise, you wouldn't have passed. I'm concerned about you knowing, like, how this works, you know? You know how to do a blood pressure on a vital signs machine because it's automatic, right? You know how to do a pulse ox, it's automatic. You know how to do temperature, it's automatic. Or you put it in their mouth, boom. Do blood pressure, boom. It's all automatic in the hospitals, you know. You can do a bath, you know. It's about time management, learning when to prioritize certain tasks, and when things can wait, when to say no politely to someone, when to act quickly and get help. You know, these are things they don't teach you in school. You know, you didn't do your state exam on these things, you know. So they just check you off on your skills. You did a little written exam. So that's my biggest thing during the precepting, and I think that's the best way to teach someone. So having 6 12-hour shifts that are very long, a lot can happen in a 12-hour shift. As an instance, yesterday my day started off very slowly, and then I ended up with 2 rapid responses and a patient bleeding out of a site. It was a very busy afternoon, so you never know what you're gonna get. So one of the things I do as a lead nursing assistant, lead tech for my floor, is I precept. I'm the main preceptor, and I usually, towards the beginning, of course, I help, hiccups. You know, I'm right next to them in the rooms and I'm precepting. I'm like creepily there watching them. But then towards the end, like during the first, like the third 12 on the first week, I am outside the room now. I am letting you go in the room, doing the vitals on your own, talking to patients on your own. I'm just there listening, making sure you're doing what you're supposed to be doing. And then by the final week, by the second week of 12s, I basically let you do you. I let you chart everything, do vitals, do baths, let you do you, but I'm still telling you, okay, let's go do this now. Okay, time to do blood sugars, it's time to do vitals, it's time to go do this, time to go do that. Checking on all your charting, make sure you're charting everything correctly, because I'm a big stickler about charting. We just had a nursing assistant meeting actually about a month ago about charting and how people are slacking on charting. So charting is a big thing I talk about in precepting, and nurses tell me all the time how I'm the best charter, which I know I am because I am a stickler about charting. So charting is very important. We take care of patients just like nurses do. We do patient care just like nurses do. We chart everything we do. Cover your back. I always think about covering yourself because I worked in a nursing home where a family was trying to sue staff because the patient had like marks on her and bruises and skin tears, and they felt like we weren't being, you know, taking care of the patient correctly. So charting is very important. If you're covering yourself, you're saying, I was in the room, I took care of a patient, I bathed the patient, I changed the patient's brief, I did oral care, or I offered to do stuff for them when they did it on their own, when they said they refused. It's very important to document every single thing. So never forget that. But yeah, and by the third week, I let them do their own thing, and I usually give them like a diagram, like a time frame of when to start things, when to end things, give them a time frame of when to do certain tasks. And I try to do like a time management for them, and they can follow the timeline for a 12-hour shift. But yeah, I'm also the EKG super user or champion of the unit, as I roll my eyes. I'm like, I'm just really good at EKGs, right? So when I got hired in 2017 at this hospital, I work at one of the main big hospital organizations in North Carolina, and I work at the main trauma center for one of those organizations, level 1 trauma center, on the cardiac unit for post-procedure cardiac patients. And when I started, I was the only CNA that was certified in EKGs. So my previous hospital in New Jersey, I was hired as a CNA, and then hospital wanted to stop hiring EKG technicians and phlebotomists because they actually get more money than we do. And they wanted to train certain units, certain nurse assistants on certain units to be certified in those two skills. So long story short, my old hospital trained me, so I've been doing EKGs and phlebotomy, which I haven't done at this hospital because I'm not allowed to do it on my unit. Like I said, every organization's different. In ER, you're allowed to do it, but on inpatient floor, they don't allow it. But yeah, I'm a certified phlebotomist, EKG technician through my old hospital. So coming to my new organization here in North Carolina, I was the only tech that was certified in that, and my nursing manager really wanted her CNAs and nurses to be qualified in that. And it's sad, but a lot of these nurses never done EKG before. So through time, I have been able to train everyone on EKGs, and including nurses, even my nurse manager. I'm the go-to person, so when someone needs to troubleshoot the EKG machine, something's going on, I'm the one that troubleshoots everything. Like I said, I train everyone on them. I give in-service on the EKG machine for the staff. When there's a new machine out and we're trialing it for the hospital, I go and learn the machine. Every year we have a competency packet for our unit. For the hospital has one, but our unit of competency, so we have to be checked off by an RN on our skills every year to show that we're competent in what we're doing. And I advocated to have EKGs as a skill to be signed off on. So everyone, including the RNs, need to perform 3 EKGs and be signed off on them. So it's part of the competency this year. So yeah, I am the super user EKG champion. So if anyone has questions about it, doesn't know how to use it, I train everyone on how to do it, train the new techs, and I'm precepting. We all have to be signed off on it. So it's something else I do. I am also in charge of the healthcare tech CNA holiday schedule. So obviously one of my supervisors in charge of actual schedule, but for the holidays, I print it up, I send an email out, I put it up first come, first basis. I tell them what holidays I need to work, you know, what like what the rule is. You have to work like one certain, one minor, one major, things like that. For full-time, part-time, what PRN people have to work, and make sure that we're filling up all the spots and it's even. What else? I do decorate the unit. That's something I chose to do. But I'm like the go-to person, so I didn't think about being the lead tech as like the go-to person, like the nurses asking me questions, the techs asking me questions. Like if I'm there, I'm the go-to person, and it's kind of weird because there's techs that have been there, that have been techs longer than I have, and they're coming to me with questions. So just remember, just because you're a tech for 10 years, 15 years, doesn't mean you're better than anyone. If you're only a tech that's been there for 3 months, you're not less than anyone, right? You could be a tech for 10 years and have a horrible work ethic and just be there just because you're there. When you could be a tech that's been there for 3 months and you have a fabulous work ethic, and trust me, it does not go unnoticed. So never feel like you're less than because you have less experience than someone. If you give it your all and you have a good work ethic and you educate yourself. And I always tell people I'm training, they're always like, how do you know so much, Ashley? Be a nurse, like go be a nurse. And I'm telling you, I've heard it from every single person I've encountered with while working, even from nurses. It's because I educate myself. I go into the room, I go into the patient's room with the nurses and see what's going on. When there's an emergency, when the patient's not doing well, when someone's bleeding, when someone's having a problem breathing, I go into the room and I'm there. Even if I can't assist with anything, just being there and listening and seeing with my eyes what's happening and how the patient's feeling, what they look like, and learning what things to look for, and learning what they're talking about, and learning terms. That's how you educate yourself. That's how you become good at your job. You could do a good job, but actually learning and not just going into work, doing baths, doing blend changes, doing vitals, doing blood sugars. That's not being a good CNA, being a good tech. Being a good healthcare tech is actually learning and educating yourself. And if I don't know something, or nurses are talking about something, I'm like, well, why do they have that? What does that mean? And why do they get that? I'll ask, and that's how I find out. When a nurse is like, I have to go in and I gotta go change a dressing, gotta go change a wound dressing, and I'm like, ooh, I wanna go, can I go? Can I come? Can I come look? Can I come watch? It's not like I'm gonna be doing it, but just to learn. So when a patient asks me questions, I'm not giving medical advice, but at least they're like, oh, we can talk about something. Oh yeah, I've seen that before actually. A patient did this, and that. They actually had them. They actually looked really good. They ended up leaving, and the patient actually had what you have. I was in the room when that happened. I'm not giving medical advice. I'm not telling them what to do. I'm just saying that I've seen it before, and the patient did okay. The patient was well. The patient went home, and it gives them encouragement. So, educate yourself. Go inside the rooms. Go with the nurses. Ask them questions. Educate yourself. Don't just go in and do your skills. Actually talk to the patients, learn about them. And the patients will ask you questions, and they can be nursing related questions. And of course, you never give medical advice, never tell them what to do. Never tell them what medications to take, things like that. But you can tell them, oh yeah, I work on a cardiac unit, and my father actually was a patient there several times with cardiac issues. And I'm like, oh yeah, my dad had that. He's doing great. He feels so much better. Oh yeah, my dad does this. Oh yeah, my dad was in the same place that he was, actually even worse. And now he's feeling like 100% better. If you follow the rules, if you follow not smoking, working out, eating better, it's really important to follow what the doctors are saying. Just talking to them like a normal person. I recommend talking to patients as if like they're your bud, right? Some people will be like, hey, Mr. Jones, hi, Mr. Jones, I'm Ashley, I'm gonna be your tech today, and just do your skills, or just be like, hi. I'm like, hey, what's going on? How was your day? How was your night? Like in the morning, I walk in, I'm like, hey, how was your night? Did you get sleep? Was it loud? Are you having any pain right now? What's the plan for today? Are you going home today? Are you going for a test today? Like, I ask them questions because sometimes I didn't get their report. I like to know. I'm like, oh yeah, cool. Sounds good. I'm sure you're gonna do great. Just like chit chat while you're changing their bed. And they're sitting up in the chair looking at you. Be like, so, are you having a good day today? Do you have any family coming today? Just talk to them. They're patients. My father has been a patient before many, many times in that floor. People treated him just like he's a patient. If you treat someone like they're a normal person, they're scared to be there. They don't want to be there. Talk to them. Make them feel comfortable. Try to find something in common. Talk about the weather. Make it fun. Make it enjoyable. Don't just go into work and do your skills. That doesn't make you a good CNA. Going into work and actually caring about patients and wondering what their life is like, and educating yourself about what's going on with other patients besides just yours, and being hands-on and learning and asking questions. That will make you become a great CNA. Trust me. And that's what I emphasize as being the lead tech on that unit, is education, educating yourself, learning, asking questions, being in the rooms, just when I had a code blue one time, and we had to rush someone to the ICU, and all precepting happened. The last time was precepting, which was 3 weeks ago. And the preceptor asked my nurse manager, she was on the floor when it happened, she came out, of course, all hands on deck, and she's like, should I go with her? And she was like, yeah, if you want to learn, go with me to the ICU, see what happens, see what the transition is going to the ICU, and people talk to each other, what the vibe is. That's how you learn, is just going. And that's what If I can't assist them just pushing the bed a little bit, I want to be included. I want to know what's going on. I'm nosy. I want to know what's going on. What's going on over there? I'm going to go in there. They seem very busy in there, you know. I'm going to go in there, see if they need help with anything. And walk in. I don't need anything, but just being in there. Hey, you need something? You need oxygen? You need gauze? You need anything? Just being involved is the most important thing I could say. So, yeah. Like I said, I didn't choose to become a lead tech. It's just because of my work ethic and who I am as a person. Like I said, there's techs that are there that have been longer than me, that have been there longer than me, or have been techs in general longer than me. They obviously weren't they obviously didn't get this position or get this title to have, or authority or responsibility to have, just because of their experience. It doesn't make you a better person because you have experience in someone. Your work ethic, who you are when you're at work, how educated and involved you are in patient care, and actually show that you're caring more than just doing your job, is what gets you further and what makes you a good person and what makes you stand out. And trust me, your nurses and the supervisors will see that, like they did for me. I was just coming and doing my job. I was like, this is what I do. And they'll be like, thank you so much, and they'll recognize me and give me awards. And I'm like, it's just what I do. This is what, you know, this is my job. This is what I do. I'm not coming here to get praised and recognized. I'm coming here to make a difference on these people's lives and try to help in any way I can. So I can recommend all that. That's pretty much what I do as a lead tech, you know, precepting. I hold meetings once in a while, talk to my supervisors, of course, talk to the techs and the issues, problem solve, troubleshoot, be the EKG supervisor or super user or champion, just the go-to person to ask questions to, and that's about it. So yeah, sorry for my appearance. I already look terrible right now, but I'm gonna go eat. It's 2:20. I have not eaten anything. Like I said yesterday, I had 2 rapid responses and people bleeding. So even though I was secretary yesterday and at the desk, I still do my job. I still help in any way I can. Jump in the room and make sure they're okay. So make sure my team members are okay. So it was busy, and I worked the next 2 days, next 2 more 12s, and then I have a 4-day weekend. So I'm gonna go find something to eat, and I will catch up with you guys later this week. See ya!